I go.
But
You're
for
unmuted.
different reasons. At 125 or 129?
29. 30 seconds.
All right, it is 1:30. I'm going to call this meeting to order. This is the Benzie County Board of Commissioners Study Session, formerly known as the Committee of the Whole. Today is June 13th, 2023, and we are in the Frank Walter House Meeting Room. Roll call, please.
Cunningham,
Here.
Janot,
Here.
Markey,
Here.
Nye,
Here.
Roloff,
Here.
Bauer,
Here.
Worsacki excused.
Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Please be seated. Okay, we have an agenda before us. I believe we need to remove 8B, correct? And let's replace that, if everybody is in agreement, with a brief discussion regarding the DTRF,
I'll brief.
real brief. You can even put that on there, DTRF, brief discussion. And does anybody have any other additions or deletions?
Motion to approve as amended.
Second.
Motion and support. All in favor, say aye. Aye.
Aye.
Approved. We have minutes to consider from 5/9/23.
Well, why don't we approve those as presented?
I'll support.
Okay, we have motion and support. Is there further discussion? Hearing none, all in favor, say aye.
Aye.
Aye. Opposed, so moved. I will open the first public comment. Seeing none, I will close the first public comment. And that will get us to our HR updates with Jackie Healthy. Good afternoon. Hi.
I'll be brief today. I don't have much to update because we're in the thick of budget season, but I just wanted to give you a quick update on just a couple of things. First, we have some new employees. We have a new part-time shelter clerk, a new equalization secretary, Cheryl Ryan, a new register of deeds secretary, Ashley Klein, a new part-time EMS, Chase Showers. We currently have two new work comp claims. One is ongoing and one has been closed. We currently have 3 employees on FMLA leave. We had a successful MERS event on June 8th. It was attended by, I would say, a pretty good chunk of people, probably between 10 and 15. So I was super happy with that. Some policies coming up is we'll talk about the infant in the workplace this afternoon, and then bomb swatting will be on the next agenda. And then some ongoing projects is, of course, budget season. We're still handling policies. My big one that I'm trying to handle right now is the benefits policy. So that would include items such as time off, personal time, and how we would handle those. So I'm aiming to mirror them more after the current contracts we have. Currently, the personnel policy for non-union, non-elect is use it or lose it for vacation time. And I want to allow our employees to get a payout as other contracted employer or other union employees get. So I want to make sure they also receive that benefit. And then I just wanted to say I've been working on visiting the different departments over the past few months. And so I've seen the county clerk's office, the county treasurer, and just recently I went to EMS. And we are just so lucky to have such amazing people. And it's just so nice to see. I'm so glad this is something that I'm doing. Next month in July, I'll be going to dispatch. So it's just a real eye-opening on what our employees do and how good they are at their jobs. So there's no questions. That wraps up my update. But did anyone have anything that you wanted to talk about?
Regarding the job descriptions,
Sure.
are you using an interview method? Are you using a survey? How are you accomplishing that?
Great question. So right now we're trying to work with the employee as well as the department head or elected official to try to work through these job descriptions. But we've noticed that there could be the potential for a lot of changes between some of the older job descriptions we have to the newer ones. So it might ultimately become a reclassification for some employees, but we're doing that through the process of, I would say, comparables, department heads, what the actual job says compared to what they're actually doing. So some of these have been since the early 2000s. So I anticipate over the past 20 years or so that there's been a lot changing. So it's quite the big endeavor, but after budget season, that's going to be more of my focus.
So you're hands-on with this. You're not just asking the department heads to do it. Is that what you're saying?
Well, I want what we're currently doing for reclassification is that they're giving us items and redlining big differences. But generally, I would like to see the department head or elected official provide a job description if we don't already have one in our office, and then work from there. But yes, I am going to be very involved in the process.
We do have a policy on the books that's specific to the process for reclassification or reorganization. And so some of them are just minorly being updated to add some more of that legally lingo to it and maybe some additional task. But those ones that are going to be quite changed, because I know some in like the treasurer's and clerk's office, some of the job descriptions are 20, 30 years old. And so some of those that may warrant a lot of changes may fall under that policy, which is reclassification. And then that may warrant different changes to their pay scales.
Okay, thank you.
Sure.
So
Thanks
when
so
you,
much.
when you visited EMS, were you permitted to go on any calls?
I was relieved they didn't get a call because I had so much anxiety about it, but it really gave me the chance to just talk to the employees that I was on shift with, and they're just wonderful people. It's just such a good experience, and so I was really thankful that I got the opportunity to do that. I went to station 2, so sometime this month I'm hoping I can get to station 3 before the end of the month, but I anticipate wanting to get there eventually, but it's been a really great experience.
Thanks for taking that initiative.
Yeah, it's super fun.
And the side benefit to that is that the employees feel needed. They feel like they're part of it. They want to talk about their jobs. You know, they want to be engaged. So there's that side benefit to this also.
Yeah, it really was great to be able to sit there and talk about a lot of things. You know, I see timesheets and like, I don't know what that means. So I got the chance to say like, hey, what is this? How do you guys do? What does a day look like for you? And so I'm really thankful for the opportunity, and that the employees and people have been so welcoming, because usually when HR comes to an office, they're like, what's HR doing here? And it's like,
Well, yeah, and that's the conception that you have to
Yeah.
go to HR usually with a problem. So for
Yeah.
you to be reaching out in a positive way is just really,
Yeah.
really great.
I think it's important that like I'm a resource for them. So I want them to know that. And
Yeah,
I
awesome.
think the best way to do that is show up.
Cool.
Mhm.
I do think you should go on an emergency call if you can.
No,
I
no.
was like, oh, what if I throw up or something? I'm just like, no.
They have stuff for that, by the way.
But my reputation won't be able to bounce back with that. So thanks so much, you guys.
Thanks.
Thanks for the update. Okay, and so for our topics for continued discussion, we're going to have an opioid funding discussion. I see that our public health officer is here. Dan Thorell, welcome. Hello.
So in your packet are various documents that Dan had graciously sent over. As you know, the opioid dollars, there is a lot of things you can spend it on, but essentially it's pretty limited in the big topics you can spend it on. Some of that money could be utilized towards research and fact finding, data collection, those sorts of things. And so Dan was here to really talk about what that might look like in Benzie County as far as data collection and those sorts of things. So that's why Dan's here. He'll be able to answer any questions, but what he's going to be covering is an allowable expenditure of opioid dollars.
Thanks, Katie. Yeah, so basically a few months ago, I was asked by a Board of Health member to look at substance use disorder in our district, Benzie and Leelanau County. And what I found is there were a couple of studies done, one very recently in Leelanau County. And then there was one done in using data from 2021 and 2022 in Benzie County. But after getting into the data and everything and looking at them, they were drastically different. And I can tell you the recent Leelanau County assessment was very comprehensive. It covered a large number of the population, took into account varied sources of secondary sources of information, which would be like the sources of data that are already out there, that you're basically just going after, searching, looking for, and also using primary sources of data, which means pulling together like focus groups, doing surveys of the actual, people in the county. And so, that was what encompassed the Leelanau study. And then looking at the Benzie study, it was really focused on one secondary source of data, and that was the Michigan Profile for Healthy Youth, the MiFi data that is given at schools. And it really focused on 7th and 9th graders, which, when I was looking at that, okay, if we're as a community wanting to get a better picture of what our issues are with substance use disorder, especially with these opioid funding dollars coming into the county, how best to spend those, where to spend those, what groups to target, what people to target as far as, programs or anything like that. And, looking at that study in Benzie County, it's like, well, that really, it tells us just a very small piece, a very small sliver of what is actually going on out there. And, really to just talk about, and I can talk about that small sliver, just some of the things that stood out is that, only one of the 7th graders and none of the 9th graders reported binge drinking in the last 30 days. That's one thing that popped out. Non-binge drinking was more common, with 30% of the 9th graders reporting drinking alcohol at some point in their lifetime, and 7.1% had reported that they had been drunk. Current use of vaping products was reported by 9% of 9th graders and 7% of 7th graders, which is, that's very concerning. Use of marijuana at some point reported by 19.8% of 9th graders, and use within 30 days reported by 9.3% of 9th graders. So no use was reported by 7th graders. And then, one thing that really kind of stood out that kind of dovetails into what I'm talking about is having a more comprehensive study, is that 43% of these students reported that they have lived with someone who has a substance use disorder or was depressed, mentally ill, or suicidal, which that was kind of sobering to see that statistic, meaning that, okay, so their parents, guardians, maybe relatives, they're seeing them with these substance use disorder issues, but we don't really have a study telling us anymore, diving deeper into that. So that was kind of the takeaway that I got away from looking at this. I mean, Benzie and Leelanau counties, there are certainly more places in the state that have more issues and bigger issues with substance use disorders, but we should not discount what is going on in our own community. And especially with the opioid settlement funding coming in and having the opportunity to address some of those things. We have, we've scored well. There's a new vulnerability index out there called the Michigan Substance Use Vulnerability Index, which ranks Michigan counties as to their vulnerability to individual and community adverse substance use outcomes. We did score well in that area. However, the prevalence of non-prescribed opioids and the potential for overdose, we still need to be vigilant about that, because you can also see the data about when EMS, you were talking about EMS with the HR director here, EMS administered Narcan to 24 individuals in Benzie County since January of 2022. I mean, that's, a fair amount. So really, we're recognizing, the health department is recognizing that, this is an issue, and really what we want to do is find out more, do a more comprehensive study, figure out what's going on, and then perhaps, you as the leaders here can use that information to kind of funnel the funds that you're getting from these settlements into an area that can help having an informed decision about that. I'm going to ask Emily Uray, who is one of our community health planners at the Health Department of Northwest Michigan, but she also works in the Shire, the Community Health Innovation Region, which is a partnership of the Alliance, Northern Michigan Public Health. I'm using a lot of acronyms here, so bear with me.
About a cheat sheet.
Yeah, I do need a cheat sheet for you guys, but basically we have a partnership of 7 health departments through Northern Michigan where we share information, conduct studies. In the Shire, the Community Health Innovation Region does My Thrive, which is the community health needs assessments that the hospitals are required to do. And Emily is heavily involved in that. And she was one of the authors of the Leelanau County Substance Use Disorder Assessment. So we put together or I shouldn't say you put together a proposal for you to take a look at. And I'm just going to have Emily talk about that somewhat and see what you think.
Thanks.
Welcome. Thank you. So as Dan mentioned, I'm Emily Uray, and I actually work for the Health Department in Northwest Michigan. But as Dan mentioned, that alliance or the Northern Michigan Shire, that's a partnership of 7 local health departments. And we use that partnership as a way to leverage resources that we already have. So I work with staff from Leelanau County Health Department, as well as the other 5 health departments in the area. And community health assessment, not just the Leelanau report, but a full community health assessment. We do that every 3 years. And instead of calling it a community health needs assessment, we called it My Thrive because it's more welcoming to the community, or we thought it would be. But that's really, I spend a bulk of my time doing that. So I can answer any questions that you have. And that community health assessment that the health departments lead, that's actually used for all the hospital systems in our area. That's used for the local health departments and then federally qualified health centers, and in addition to a lot of the Area Agency on Aging, the County Commission on Aging, they use this assessment as their own to meet their IRS or federal requirements. So it's really, we take great pride in assessment. That's what we do. We know that a lot of the community organizations are relying on our work. And so when Leelanau County asked us to do an assessment that was a deep dive into their substance use disorder, we really welcomed the idea. So I can share with you, you guys should have received the proposal, which is just that 1-page document. I think that if you received it virtually, there's a lot of different links, so you can see a lot of our different work that we have. I see Commissioner roll-ups. You have the full colored report, so that's
Right.
fancy. Yeah. So lucky you. So that is that's the full Leelanau assessment. And with all the assessment work that we do, we really use best practice guidance. So we have a team of community health planners like myself. We have epidemiologists, and then we also pull in people from the variety of different health departments and expert in that area. So best practice for assessment, basically, as Dan mentioned, is including both secondary data. So you can see that we pull in statistics from reliable sources. So MyFi, that was used for the Benzie County Youth Assessment, that is a reliable source. We pull data from MyFi as well. But in addition to that, we pull in data from the Leelanau assessment. We pulled in 15 total sources with 106 different indicators to really provide us a full picture of what is going on in the community. That assessment also, it should be noted that the needs for that assessment were all ages and a variety of different substances. So it's much different. We can't really compare the Benzie Youth Assessment to that Leelanau assessment because they were obviously had different needs and different requirements. So the Leelanau assessment is more comprehensive in just the number of the ages, and the different substances. Where 7th and 9th graders, I have a 10th grade boy, and I'd be shocked if him and his buddies were out drinking. I'm thankful that they're not, but it's where ninth grade is a lot different than we're talking about a full population. So it's, you can see there in the report, in the Leelanau report, that their alcohol use obviously is a lot higher amongst adults. And when it is an issue that's also identified, by drinking or by number of drinks and things like that. So we break it down a lot more based on the age appropriateness of the questions. Similarly, you'll see that we looked into methamphetamines, opioids, marijuana, vaping, and smoking. And then the other side of the best practice for assessments is looking at primary data. So Dan mentioned that includes focus groups and surveys. We really pride ourselves at having local people really customize these surveys. So we look at best practices across the nation, but really the people who are developing these surveys are working at local health departments. So they're writing the survey and speaking to local residents. So if there's questions about specific areas or things like that, you can tell. And when you're reading through the surveys, you can most likely tell that somebody who knows your community wrote the survey. That we're really trying to make sure that assessments don't sit on the shelf, that assessments are built to move to action. And that those surveys and focus groups, we're talking about not just the issue, but what assets, what gaps are in the community, so we can move forward with solutions and use the assessments to be able to build something off of. So those primary data is focus groups and surveys. You can see in that Leelanau assessment, we had 2 different surveys. We had one survey that focused on stigma, and one that was just a broad community survey. And then also had stakeholder interviews. I will note, if you read that report, there wasn't very many stakeholder interviews. We quickly found out, we thought we were going to do focus groups. And we quickly found out that there was so much stigma in some of these smaller communities around the use of drugs that they didn't want to come to a focus group because they thought they would run into their neighbors and then out somebody in their family or out themselves when they were talking about it. So they had to be all one-on-one interviews. I do not live in Benzie County. I come here and go to your beaches. I live in Traverse City, and I was excited to come here early and go to L'Chaim and get some of my favorite bagels. But I assume that Benzie County is very similar to Leelanau County, that you are a tight-knit community and people may not want to participate in focus groups. So it would be probably primarily one-on-one interviews and things like that to really allow people to speak freely about what issues they're experiencing. Let me see. I had a couple of different things I wanted to touch on. I just want to make sure I'm getting to all of them. Because we do assessments, we continually improve our process. I really, in that proposal that I included, I really just included 4 different key elements that we found are most successful with proposals. That encompasses the gold standard of both secondary, primary data, as well as moving to action. So that's the data summaries and priority settings. We found that if we leave communities with just the assessment and just a report, they sit on the shelf. So having participatory meetings that we're talking about the data and really allowing organizations and residents to be able to better understand their community within that local context is important for them to continue their work. Also, is like sometimes there's groups that where in Leelanau, for example, they had a substance use coalition that was working. And so we worked with their coalition membership to do some priority setting events. And then also left them with a report, a dashboard, and some visual slide decks and whatnot. Let's see. I can say that with as we continue to evolve in our assessments, we continue to leverage the relevant assessments we've done in the past. So if things are new data that we collected or things like that, we can continue to build off of that. And that's really the basis of My Thrive, or that regional effort Dan mentioned, is that we're trying to really leverage the expertise regionally and what work's already been done, instead of just coming in collecting the same data that somebody else did and building off of that. It's like really we're looking at what's already been done and where we can minimize duplications. That includes with primary data collection. I'm sure that you all can attest to having people ask you to take a quick 5-minute survey in your email or, you know, when you go to Target. So we're really looking at what we already know from community members through other groups too. So that's like the staff time. We'd rather spend our time gathering that data and being able to analyze that with our team of epidemiologists than go and collect new data and use that data to inform the survey that would be new. And then Dan did a good job talking about that substance use vulnerability index that was launched during their data collection efforts of that the Leelanau substance assessment. I'm trying to remember. I think it's around page 35 or 36 in the report, but it has some really great screenshots of that tool. And that's what's really great about the past couple of years of data collection. It's starting to become, instead of by county or by zip code, we're starting to be able to drill down data on census tract. So you can see in some of the graphs that we have within that report, you'll see kind of it's like almost heat mapping that really show us where we need to target interventions. One specific area, I think it's in the demographic section of the report, which I'm jumping around, but that would be in the beginning of the report, would discusses health insurance rates. So you could see what like subsets, census tracts in your community have low health insurance coverage. And understanding that, then you could understand how people would be able to access treatment facilities. So that was one of the top 5 issues of why people don't access treatment in Leelanau County is that they didn't have health insurance coverage. And so it's like all that data that we collect, it sounds like a lot, but when you really start trying to figure out how are we going to identify solutions to these really complex problems, then you realize that all of these things are related and you need that demographic information. You need to understand the community at the local context level when you're trying to implement solutions, or you try to implement something and then wonder why it doesn't work later on down the road. So having a really robust assessment is imperative. So I am going to switch gears to looking at that assessment. And you can see I have 4 different key elements. There's the secondary data collection. I spoke a lot about that and provided some examples of what type of data that is in the proposed deliverables. And then also the primary data collection. And those would be that tailored survey and focus groups. And then the summaries and priority setting events that we did, and then the report that would include both the report, a dashboard of data, as well as visual aids. And I did want to note that when Dan asked me to do this, I was like, I can talk all day about this. So I was like, oh, maybe I'll have more time because it's raining outside. On sunny days, people are like, hurry up. So I will stop there though. But I did want you to just take a look at that proposal and have it be more of an open conversation. When Dan asked me to put it together, he wasn't really sure on like what kind of scope you were interested, if you were interested in taking a deeper dive in substance use assessment at all. So I wanted to come and provide you guys with some information, kind of start a dialogue, put together that like top tier proposal. And then if you are interested, we can talk more about that, of what the different options are if you're looking at less of a scope or something to better meet your needs and your budget. And we can come back with specifics for that proposal that I put with the 4 or 5 different elements. That was we broke it down with staff time and travel supplies and whatnot into about $22,000. Does anyone have any questions? Yes.
I actually do. With your data that you have collected, was there any way of telling if students that were no longer with parents or taken out of the home because of the various abuses? Did any of it target that? Have that information?
We did not.
Okay.
The MiFi, the past Benzie study, which I didn't author, looked at MiFi, and MiFi has they do have like an environmental question that has to do with homelessness and being kicked out within the past 30 days, but it doesn't say the specific reason that they were kicked out. Thankfully it was low. With the low sample size, so this gets complicated, but with MiFi, they had a low sample size for Benzie County, but in addition to the low sample size, the students don't answer every question. So the denominator keeps switching on you. So if you're looking, when you're trying to do it like apples to apples, but when you're looking at the percentage in the Benzie report, about one student to 1.5, one student is 1% to about 1.5%. So with Benzie County in that assessment, I think there was one 7th grader and maybe one 9th grader. It could be 2 9th graders that had been removed or been kicked out of their house or felt like they were thrown out of their house for a reason. Mhm.
Thank you.
Mhm. That's what's so great about the community surveys, that primary data collection, is because you can dive a little bit deeper. I found it really helpful to look at secondary data like that MiFi and then start asking people like, what are the questions? What do you still like? What questions do you have? And maybe that's a question. And that's what's so great about harnessing that primary data collection and customizing surveys, because you can dig in deeper with specifics that you're looking for.
Yeah, I was looking for specifically what's known as kinship.
Yes.
So
Mhm.
that is difficult getting this
Yeah, it's
statistics on this.
Yeah, and something that might be helpful is just with, I know that MDHHS is starting to collect additional data on kinship because there's so many grandparents that are taking care of their grandchildren, and it's a huge gap in the services that MDHHS provides, because then they don't have access to food assistance, cash assistance, daycare assistance. That a mother would have access to, but because the grandparent stepping in, that kinship. So it's really a devastating gap in the community.
I was just hopeful that you would be able to tell me a few things in there.
Mhm.
Okay, thank you.
Mhm.
This is a huge responsibility to have this opioid money coming in, and I think I share the feeling of the full board when we want to use it in a way that has the most impact.
Mhm.
So can you tell me, like, after Leelanau made the investment to do this in-depth survey, I mean, you get the information, and then how do they use that to impact the problem? What did they do after the information was gathered?
Yeah. So they've done a couple of things. This report was just released in February, I believe. So they did a couple of things. And first of all, they tackled stigma. And so since the report, they had first changed their name. So their name used to be the Substance Abuse Prevention. And they're like, we are not preventing it. So we'd like to. And then abuse is stigmatizing. And so they really worked on how they're going to message themselves to the community. And they have, done phenomenal jobs on just kind of like changing the way they're talking about it within the community. And then also, I know that they had an emerging issue. The sheriff in Leelanau County is on the prevention coalition, and they had a couple police officers who, in responding to a drug issue, they had accidentally had an overdose. And so they actually had to use multiple Narcan on their officers and then rush them to the emergency department. One officer was in the in the hospital, Munson, for a couple days. And so then they started doing naloxone trainings. And really, it really changed. I think it works both for education in the community, but also reducing stigma. It's like, now it's like literally anybody could have this issue, even if you don't intend to have the issue. And so they really worked with the community on how to train everyone to utilize naloxone. And even the sheriff, was training the coalition, trained the coalition members on how do we be able to support our community using those things? And like little things like that, it's like where it's not a lot of money because he's there anyway. He's like, actually, I have a candidate audience, right? And so he just is like, it's like, this is what we need to do. And so things like that come up. And then it's looking into the report, looking into your own networks and figuring out, okay, who else can we push this out to? So it's like it's the whole point is that we're trying to utilize a small amount of money, but in a way that makes the most sense per the community.
Sure.
So another thing that I've heard, I mean, that study is fairly new, right? It's only been out for a few months, but one of the things that was identified in it is there's just not a lot of options for treatment, here. And it's, I think it said like 8.7% of the population live within 30 miles, right? Which means everybody else in Leelanau County lives much farther than that. So you're away from your family support networks, all that kind of stuff. And the treatment options like in Traverse City tend to be expensive. So that is, that's a huge problem everywhere in Northern Michigan to find a place to seek treatment. So, I mean, I think that's kind of filtering into the bigger community conversation, about how do we tackle this problem as far as like treatment for people that are abusing substances, or using substances, not abusing. Sorry.
And also that speaks to like, if people are traveling so far, it's like, it really goes back into the community where that's our work. So when you look at the Benzie County BIFI report, that the students identified that almost 50% of them lived in a household with somebody who's abusing drugs or alcohol. And so we don't want to send them all, like we can't physically do that, but also we can't as a community send all these people away and then have them come back and not have their network. So it would be of interest to figure out what we can do as community to develop solutions that are homegrown in our local to keep them.
Did Leelanau have any kind of wraparound program that includes support once they go through treatment or something or anything like that?
But that's really like out of the scope of the
Okay.
coalition at this point.
Okay.
But yeah, that is something that like
Well, I
think
was
like
thinking,
Munson is kind of looking at
Mhm.
like, oh, how do we have a coordinated transportation system to get them back and forth? How do we, because people, the other thing is even if it's 30 miles away, we drive 30 miles, I drove 30 miles to get here, but they can't drive 30 miles because they don't have a driver's license, and so it's like, how are they, even if you're doing AA or NA or things like that, it's like, you can't even access minimal amount of supports. Don't have a driver, you can't do much without a driver's license in Michigan.
Yeah, one of the things, I mean, from the health department standpoint, in the last 5 years, we've gotten into like through our community connections program, community health workers and how, and we've shown, how well that works, preventing things upstream before they become bigger problems.
Mhm.
And the return on investment for that is huge, saving money. The biggest example is saving Medicaid. I think we saved like $3 million in Medicaid services just by getting people things that they need instead of having them show up at the ER, right? Which is way more expensive. So, we have talked, internally a little bit about, wouldn't it be great as a model to have some sort of, a community health worker help navigate people through this treatment system, because I think, in what I've heard lots of stories about this. I mean, a lot of them are anecdotal, but just people give up because it's so difficult to find the resources that, they just give up because it's so hard, it's so hard to find a place to get treatment. It's so hard to stay in. It's so hard to get, transportation there or whatever. So if they had somebody that could support them and help them through that process, that was something that we were talking about as far as that would be a great program to do,
Who funded this study for Leelanau County?
On the first page, it was through, I didn't want to print it because I didn't want to waste. I'm sorry. Yeah, it's on the first page of,
Michigan's Prevention Network?
Mhm.
Who are they?
They are a statewide agency and they funded multiple different, I believe they funded multiple different assessments. I know that Manistee had an assessment. We didn't conduct the Manistee assessment either. I think that's actually who funded the My Thrive or the My Five assessment for Ben too, but I can provide more details. I wasn't, they had already identified us as the contractor in that before we heard too much about that. I don't know, Dan or
I don't know
or if
much
Michelle
information.
from Benzie did, but or health department had. But it was, from my understanding, there wasn't it was like they gave the money. They wanted a couple of deliverables that were we went above and beyond. And then
It's a nonprofit. The Prevention Network is a nonprofit and their partners are Mid-State Health Network, Michigan Health Endowment Fund, Lakeshore Regional Entity, the Liquor Control Commission, various partners, but they're a nonprofit. Is who that group is.
Any questions?
See us looking for problem, which we're aware of. I'm still having trouble seeing the solution. And maybe that'll come later. But other thing I noticed on your numbers, marijuana usage in the schools is a lot less than I would have anticipated with all the dispensaries around locally and stuff. And actually, it looks like the adults are doing most of it. So maybe I'm misreading that, but that's how I looked at it.
Well, and keep in mind, Gary, that those numbers, I mean, it's 7th and 9th graders, not the, they also look at My Five surveys, 11th graders too, which I think you might see, a difference there as far as marijuana usage, but in the numbers, the sample size is fairly low. So I don't know how, it's not giving us a really good picture, accurate picture, but I think you're probably right. I mean, the adults are the ones going by, driving past some of those places. I mean, the parking lot's usually pretty full, so.
there was so many things going on too. I don't know, because the Leelanau assessment has both like an adult for marijuana use. So, and the Benzie assessment. And I think even in the Benzie assessment that My Five, since it was a couple of years ago, so I know that not specific on the exact year or date all allowed dispensaries here, like it kind of was like
By township, I believe,
yeah,
right?
so so that comes into play, and then also whereas in Leelanau, they were proud that they didn't have the dispensary, but they can deliver there. So it's like, oh, it's coming across, it's like going to Traverse City or come over here, it's like, so it's kind of nuanced there, but also the youth, even in an anonymous survey or the focus groups, like they're like, absolutely no. And then I was like, well, we can do one-on-one interviews, and they were like, so you want to do a one-on-one interview with me and or a survey, and I'm going to tell you that I'm breaking the law. So it's a little bit, it's more challenging with the youth for the Leelanau assessment. We wish that we would have been able to harness like a trusted person that they could connect with better and share those types of things and know that we're not going to get them in trouble for breaking the law. But definitely, I would say for the Benzie report for all subs, I think that obviously there's going to be an up after 9th. God, that's at 11. All because 11 and 12, right? Eye-opening. After they
reluctant to say it, but so knowing this, how do you trust the data? If the kids aren't telling the truth, you know, I mean, how do you trust the data if they're going, oh, I don't know this person and I don't, so no, I'm not doing that. And I'm not, you know.
Well, that's a good question. I mean, that's one of the big criticisms of those like MiFi, some of those school-based surveys.
Yeah.
Yeah, and
Um,
it's really
yeah.
what we try to do. That's why we really applaud the gold standard of both using primary and secondary data collection, is because it's where you're connecting with different people. And like with that Leelanau assessment, we use 50 different sources. So it's like you're connecting a lot of different this. And if you just use one survey, or if I just want to use like, oh, I'm going to go knock on doors, then that has significant flaws. But when you're really compiling all of it together, you're really getting a better view. So we're really relying.
They walk into the school and talk to the robotics team instead of the partier group, you know? Because they're not.
You gotta throw out the high and throw out the.
Yeah, that's.
Yeah, there you go.
Yeah,
Right.
interesting.
Yeah.
So in your opinion, though, this is advisable use of opioid dollars, is gathering information on this subject.
I mean, otherwise, I just kind of think you're throwing darts at a dartboard, as far as, figuring out what the best use of the money is. I mean, you're getting, and I know the money varies over, the different settlements, different time periods, maybe some different requirements, but it's not insignificant. It's not a huge amount of money, but it's not insignificant. So you definitely want to make sure you're getting it to the right place, so I think, I mean, just looking at it and looking at the lack of information, Benzie County specific, it just makes sense to me that you would want to get a better understanding of what's going on in the community, including adults, all age groups and that sort of thing. So.
Agree. Any other questions?
Very
Excellent. So,
interesting.
yeah, it is. We've had, I think this is our third or fourth presentation option, because we are really seeking how to best use these dollars. And so we want to make the most educated, correct choice to have the best impact. So we appreciate the information and we will continue the conversation.
Yeah, absolutely. And if you want a more detailed, proposal with dollars and, exactly what the deliverables are. Like I said, Emily mentioned, this is kind of like the gold standard starting out, and we estimated about 22,000 for this, but it doesn't mean it has to be that. It could be, a little bit less, or you could say, well, we have, we don't quite have that much. We want to spend 15,000. What can we do for that?
We wanted to focus specifically on our high schools. We have two high schools. Is that an option? To say, we're concerned about our kids. We want to focus here. Is that something you could do, or is the region, is the whole?
No, we could target a specific population. So I don't know a ton about the opioid settlement dollars. I'd like to.
You mean as far as like what
Yeah,
the strings attached?
Yeah, what the strings attached are. If you have to have like a number of people who are using opioid, because I'm sure that they have opioid use. If they're not using, I'm sure in their household they're using. So how to sort of roll and.
Yeah, there's various things you can spend it on, remediation, prevention, but data collection and research into making an educated decision is one of the big things called write out in Exhibit E, is doing this sort of data collection. And then there's other sections about remediation, prevention, education, those sorts of things. But the data collection piece is one that's called write out as an allowable expenditure.
So if you wanted to do a more targeted approach, let me know, and I can up a different proposal.
Okay.
Being more targeted would change things. That is like going so global. Proposal, but and if you had
Just an option.
I was also looking at funding. I don't know if we could use substance use disorder funds for this, but we currently have about $200,000 in our.
Right.
We're not using the funds that we were collecting from.
And we have about 85 still of opioid dollars that we haven't allocated, and there's more money coming of opioid dollars. So you could do a shared approach. with that.
Good to know.
And
Thank you.
in the report, I'm Emily, I'm the top author, so I think it has my email address in there. If not,
I can get it to,
Okay.
yeah.
you can ask me questions about the proposal, but also about the report, or Karen, if you want to talk the kinship.
Perfect. Thank you. I would.
You're the
I'll
top
reach out.
Emily and I'm second Emily.
I'm
Emily,
the top Emily. I'm Emily.
You're
the
the top
double
Emily.
L.
Oh,
yeah, it's,
I'm like,
it
there's
sounds,
two Emilys.
it sounds different than it's spelled,
Okay.
right?
My husband's not from the area, so it's Ure, and there's a rolled R, but I've never been able to roll my R's. I feel Spanish like every year, but he's from Spain. I was Newhouse before, and it was so easy.
Thank you very much.
Thank
We
you.
appreciate the presentation.
Thank you.
thank you.
Okay, that moves us on to our very brief discussion about the delinquent tax revolving fund. I brought this up in our conversations about funding the EMS expansion, the $600,000+ out of the
Lower level
the
expansion.
lower level expansion, say it right, Rhonda. Brought up questions for me because as in my term as a commissioner, I know that the conversation about Station 2, when Station 2 was built, that was out of the DTRF. And my understanding was it was considered a loan, but there weren't any payments being made. There was never any agreement or any documentation of this created, and it basically sits out there as a receivable upon the maybe sale of the building at some point. It just seems very willy-nilly to me. I don't know if this should be considered a loan or if this is just a really valuable use of DTRF funds. It just, to me, sounded worthy of clarification in a conversation. Gary, you've been around longer than most of us sitting at the table. Were you here? You weren't here when the Station 2.
No, but I've heard the story and I thought the loan part of it was to build a garage, housing the ambulances and stuff, and that was part of it. I was a little concerned that it was set up the way it was. But I'm also concerned about DHHS, how that was set up, but these things are done in the past. I don't know what the remedy is. Bob sees it as a county function and not to ever go after the money, but I don't know if we'll keep it or not, if it'll get sold in the future.
I don't see how it could be sold.
Don't
It's part of
either,
the
but,
campus. I
you
mean,
know.
and it does, increase the valuation of the campus. I just think we need to have this conversation, or maybe just put it, let's touch on it and maybe discuss it at another meeting after everybody has time to think about it. But before we enter into this fiscal agreement without any paperwork or any understanding of what's supposed to happen down the road, I think we need to have a clear path with why, it's okay with me that we use these dollars to do this, but if this is supposed to be paid back, or if this is supposed to be captured or forgiven at any point, let's make that very clear on the front end. So we know going in, and if we can rectify any of the situation with Station 2 as this body, decision-making body, to make that more clear moving forward, it seems like we could clean that mess up too. So that was my only point in bringing this up. I know we're not going to come to any resolutions today, but before we move forward, I think we should have a clear path on this.
Yeah, it's my understanding that it's listed as a receivable in our general ledger. So in the DTRF fund, it says due from EMS Fund 214, but then it's zero. And my conversations with Shelley have been that the intent was for EMS to pay back the portion that they agreed to, but there wasn't anything real official about it, no payment structure or anything like that. It's just listed as a receivable, but there's never been a money transaction towards that receivable. So yeah, the conversation came up in agenda review. How are we going to treat the lower level expansion? Are we going to treat it the same way where it's listed as a receivable and maybe someday we'll pay ourselves back? Or is it just forgiven and here's the money towards that project is for the betterment of the county and we're walking away
Isn't
from
that
it?
excess funds that we're talking about? in the DTRF, which would have ended up in the general fund anyway.
I think that'd have to be agreed to by all three entities, the board, the administration, and the treasurer.
And the
I think
treasurer.
that was,
What
Yeah.
would have to be agreed to?
that
excess
those were
funds.
excess funds.
I
So-
know that's strictly the Board of Commissioners decision now. We had legal opinion on that.
Well, but we adopted a policy that says that the board, the administration, and the treasurer will come to an agreement versus just a yes or no. We came to like a compromised approach in Benzie County, so that's the policy that we've been operating under. And the policy also states that we'll maintain in the DTRF at least 1.5 or 1.7 the times the amount of money needed for the taxables based on the preceding 3 years. And then there's also money maintained to cash flow the other funds until taxes come in. And so that's kind of the equation we've been working off from. And then we determine how much comes into the general fund. So that adds another element to it is the payback just not moving money into the general fund? Or do you still move money into the general fund and you just remove this from DTRF?
Money that you're talking about for this project does not deplete the DTRF.
No, there's
Below that level that you were
5.6
talking.
million sitting in the DTRF.
All right, thank you. They've got to be, it has to be enough in there to cover anticipated obligation.
And
And
typically
it's only been in
taxes
the
are
last
like,
3 years, by the way. I know I've been on the board 7 years now, and when I first came on, I was told emphatically that the treasurer made that decision, period.
I
And it's,
know.
and then about 2 or 3 years ago, I personally insisted that we get a legal opinion on that, and
Correct.
it came back. So there was obviously a compromise made in some kind of procedure
Yeah,
policy.
this board adopted a policy. So there's about $5.6 million sitting there. Typically, the delinquent taxes that are repaid are 1.2 to 1.5 million that are actually paid out. So that's the absolute minimum. Plus, so we've set in the policy 1.5 times. So you do the 1.5 million plus half of that would be the absolute minimum maintained in that fund. And right now we're at about 5.6 million in the fund.
Brenda, to your question, where I distinguish the difference, first, I want to digress for a moment. That receivable that we have on the books for Station 2, because there's no documentation for the purpose of GAB, General Accepted Accounting Practices, that is not a receivable because it's not documented. And anything over $10,000, as I understand it, has to be documented if it's planned to be recaptured. So we have that out there as a task, but it's really, I'm surprised that the auditors haven't caught that. Where I distinguish the difference is that this campus over here that we're improving the asset of the government center, not an asset for central dispatch or anybody else. And as a result of this improvement, we're going to benefit. We're going to be able to use space differently around the campus.
Mhm.
That's a clear distinction from EMS, where they have a freestanding building. And if they ever abandon it, where does that money go? Well, that definitely comes back here.
Well, it doesn't definitely come back here. It's unclear.
Well, in my view, it
Well,
should
then
come
we
back.
should have a document that has a reversion clause.
I would have no problem making sure that happened. But that's where I distinguish the difference.
No, and I would agree. I mean, I don't think you should have to, I mean, these are taxpayer dollars and it's, it has an intended purpose and I just don't see the point of paying it back. It's going to
It's going to enhance the community.
to enhance services in the community and it's becoming an asset on the campus. I mean,
The only value to having it as a receivable of some kind is that if it was ever a money grab and the county was coming up short on something and they wanted to use money from central dispatch because they had an abundant surplus, technically we wouldn't be able to do that unless we had this arrangement that said you had to repay that debt.
And I think that was the intent of the receivable in the DTRF for EMS, given the state of things in Benzie County. I think that situation you just said is probably what kind of the intent was of why they put it on the book, so that if we needed it, we could take it.
And maybe, and again, I know you're not looking for solutions today, but having said all of that, maybe the appropriate thing to do is to have a written agreement, but write the language in such a way that it's at our discretion whether or not we want to exercise it.
I would think just like a resolution. I mean, at the end of the day, it's all yours, EMS, they're all your entities. So just some sort of formal resolution or, something in place like that, a resolution that says these funds are from this fund and this is the intent of that, repayment or not repayment. And yeah.
And what it does is lay out for future boards what we were thinking at this time, because right now we're guessing about Station 2. We
Right.
think we know the right answer, but
Right, yeah, that's the purpose of the conversation. Let's do this correctly. Let's clean up what happened in the past and do this correctly moving forward.
I'm on board with you.
Here's the point. So we can revisit
Makes
this at
sense.
another meeting.
Yep.
Okay. All right, let's move on then. This is gonna open the conversation to our infant in the workplace policy, pilot program policy.
So this policy came forward, I want to say a month ago, roughly. And it was just a draft pilot policy. This board had lots of questions and wanted to kind of hear from, staff in general. And so Jackie went ahead and did a survey of all the staff. You all should have received the survey as well. It went to the all staff email regarding the policy and if, staff persons would support a policy like this or similar to this or not. And so those results are in the memo as well as the policy, which had some changes from legal in it, some more legally lingo. I think you also included the survey in there so you can see the breakdown of all of the questions and how those came back. And so we're bringing it back now for further discussion to hear, is this something you want to support? Is it something that you do not want to support? That's kind of where we left off.
You want me to remove myself?
You don't have to leave the room.
I don't want any pushback from anybody else that says
Okay.
this was.
Oh,
Oh, well, it's not just Rose. There's other individuals in this building who have babies coming who are also interested in participating in a program such as
I
this.
get it, but like I said, I don't want.
No.
Anybody to think I had any impact, positive or negative against this.
You sure did not.
We whited out. Bob.
I know you'll
white it out.
We should have put this first.
There's just a few things I wanted, so legal is still looking over a few things of it, so there'll be a final draft. If it does get to that point, just to give you a heads up about that. And then I also included a letter from a former colleague of ours from the city of Traverse City who participated in the program. So I thought it might be interesting to have a firsthand perspective. So it was Caitlin Aldridge, who's now the Village of Kingsley manager, but her note is the last page of your packet, just to kind of give you a heads up of what you're looking at.
Was there an option for people to give written feedback?
No, they could have replied to the email, but the survey didn't allow for that because you had to get the premium package, but but I offered the chance to email, but I know that got rid of the aspect of being anonymous. So I could see I didn't really get much information back. So I understand why, but I just wanted it to be an opportunity for employees to talk or come and talk to me at any time. I haven't had that really. So the survey is the best results we have so far. And I thought they were pretty informative. It wasn't overwhelmingly no or overwhelmingly yes. So I found that to be encouraging. And you can think of it more as this is an opportunity for a department head or elected official to make the determination. You guys are doing a blanket yes and then leaving it in the hands of each department head or elected official. If that's an easier way to think about it.
did you want to say something, Gary?
No. I'm not having any more babies, so.
So we asked specifically, we're interested in the staff's feedback on this.
Yes.
And it really isn't evenly divided.
No,
It's
it's-
65% said, I don't even care, or no. And so that's how I interpret that as not sure. It tells me they're not passionate enough about it one way or the other.
Yes.
So you got 65% of the respondents that said, nope, I don't think we should have this policy.
No,
Well, I
that's
don't-
not
no,
true.
I
No
think no
opinion could
opinion
all
is-
be yes. You don't
Yeah.
know
What's
that.
that?
You're-
No.
No opinion could be yes. You're swinging at
Correct.
pessimist and you could be an
Yeah,
optimist.
so
in
it
this
was
situation.
45% no, 36 roughly percent yes, and 18% no opinion. So I anticipated the no opinion were perhaps departments that weren't affected by it, so they didn't have an opinion. That was my assumption, is that this doesn't affect me. I don't want to participate in determination. So that's what I meant, is not by overwhelmingly yes or overwhelmingly no.
Well, for my interpretation, I'm going to tell you that I think when someone says, what's the response? No opinion. Tells me they're not really supportive of it because they don't have an opinion.
Yeah, but they could have just as easily clicked no if they didn't want it.
I get it. I get it. We're going to have a disagreement about how we interpret that. That's
Sure.
all.
Right, and there's no way of proving it one way or the other.
Right.
Okay.
Oh, great. I look at it as a benefit
No laughing.
Yeah.
to the folks that can do it. Also look at it as a responsibility to the department heads. They're ultimately are the ones that are gonna make the call.
Yeah.
Yes.
So, I mean, the first time the babies are screaming, party might be over. But if it's a benefit and it helps somebody come to work a little more,
I'm in favor of the department heads. They know their departments and making the judgment on that.
Well, and at the
And I
end of the
think
day
it
too,
moves us forward a little bit also with enticing other people to be here. It's, it's more of a modern benefit. It's the way I look
and it's
at
a
it.
short-term benefit too.
And it's very short term because it's the young, what is it, 3 months?
6 weeks.
up to 6 months. Yeah.
Yeah, 6 months.
Sorry.
Well, and
Six.
the other thing to keep in mind too is an elected official could allow this to happen whether you have a policy or not. I mean, they can do certain things that department heads couldn't as an elected official. And so this policy doesn't necessarily force anybody to do anything.
It gives an option,
It
right?
gives an option.
And apparently the attorney didn't have any problem that from department to department, you could discriminate. So one elected official says, I'm going to allow it. Another says, I'm not. That we're not going to be faced with some kind of discrimination problem.
That's happening now with other policies. Elected officials don't have to enforce policies.
Can you give me an example?
Years ago, when there was somebody running for office, one elected official enforced the no campaign signs and somebody else didn't.
Thank you, Rhonda, for.
Okay. And the good news is that nobody challenged us on it, I guess, but
Yeah, I don't know. I wasn't here. So yeah, so elected official doesn't have to do this policy at all. They don't have to support this policy. They don't have to enforce this policy by any means, or they could allow it. I mean, you go downtown to the governmental center, there's a dog at work every day. And that's because an elected official brings the dog to work every day. And even though it barks everywhere and pees all over the floor, nobody can do anything about it. Because she's an elected official who has that authority to bring that dog if she wants to. So, even if this policy doesn't go through, an elected official could allow their person to bring a child to work.
we're at roadblocks, really it roadblocks you.
Yeah.
Because everybody else reports to you.
Right. Yeah.
You couldn't make that decision unilaterally. You would need our permission to implement this policy
Or not elect. Yeah.
for people that are under your responsibility.
That's 6 weeks or 6 months. That's usually the hardest to find anybody to watch your baby.
Actually, a lot of daycares won't accept babies that are younger than 6 months old. So yes.
Actually, I would like, if you would allow me to read just a portion of Caitlin Aldridge's letter, just that kind of addresses that exact commentary where she said, if it wasn't for the city's policy, I would have had to resign from my position for a number of reasons. Daycare had to close at the smallest sign of illness due to state and federal regulations. Waiting lists were over 12 months long. My child required one-on-one care for the first 6 months, and a daycare setting wasn't appropriate for the needs or the minimum staff to child ratios. In-home care costs more money than I brought home. Adding a new family member to our household meant unexpected illnesses, appointments, and schedule interruptions. Meant more unexpected illnesses, appointments, and schedule interruptions. So I just thought it was really beneficial for her just to give this really firsthand perspective of what we can do for our employees. That a lot of people, I don't want to say a lot of people, that's, 45% said no, but 36% said yes. And 18% said no opinion. And so, I just
Did we split the
wanted,
difference?
There you go.
I just wanted to kind of give this just firsthand perspective. And I was really thankful that she was willing to do that for our office to just, I think it's interesting and it has a little bit more weight when you can hear someone who actually went through it.
And
Yeah.
44 people, is that a large percentage of the people that answered? I don't know how many people work here.
Yeah, about a third.
Yeah, it's about a third who responded.
So you had 2/3 of the staff that chose not to even respond, huh?
Mhm.
Well, this is just a discussion today.
Yeah,
We
yeah.
don't make any decisions here at the study session.
Nope.
I wanted to love this policy.
Yeah.
I really want to love this. I'm struggling with it. There are very passionate people on both sides.
Yes.
There are people who really think this is a bad idea and there are people who really think this is a good idea. And my first instinct, I have such reverence for motherhood and it is the hardest job in the world, the most rewarding, but the hardest job in the world. It to me, I have to weigh the taxpayers and the people you represent with the people who are coming to work and getting the check, and there is production loss. There's not going to be a baby in an office where the same amount of work is going to get done. It's just not, and it's silly to think that it is. And I wish she would have addressed that. I wish it wouldn't have been like, this is how this is how it worked for me. And I wanted to hear the reality of it. And I wish it could have drilled down more on, there were people who didn't like my baby being in the office and what that looked like and how much work. I mean, I was 20% less productive, but, so I would like to hear an account of how it actually works. I see the benefits for the woman, but I also know it vilifies people who don't want to go to work and be around children. It does. It just does. I reached out a little bit in the community to bigger companies. I was surprised at what I found. A couple of the big, and I'm not going to name who they are, but two of the bigger companies do not have a policy, but they allow it. We look the other way because we don't want to lose our people. I've walked into offices and seen a playpen in there and gone, oh, you're bringing your kid to work today. And they just kind of view it as a temporary inconvenient. I'm sorry to use that about a child, but a temporary inconvenience
In years worth.
That's what I was
to sustain an employee.
Sure.
And to be, the term was used, community minded, considering the, and then I heard, I spoke with other commissioners in different areas and, I was very surprised when a female commissioner, absolutely not. Absolutely not. Work is work. Don't do this in your county because then it's going to come to my county. And then I heard from other people, I talked to another bigger company who said, and I shared this one with Katie, just, they're not even allowing children in the room for remote work because it's so disruptive. But by the same token, I'm very torn. I'm very torn. We don't have daycare in our area and we should be working on that bigger solution. And if this is an opportunity, to me, it's a policy and it can be changed. Do we know if it won't work? We don't know yet. I mean, it could work in some instances and not in others. And the policy provides for that, for problematic issues. It's not supposed to work. And then you could have situations where I didn't even know she had a kid in there for a couple months. Does it need to be as long as it is? 6 months is a long time. 6-month babies are pretty mobile, pretty active. They're not sleeping as much anymore. Very reactive, very interactive. I don't know if that's too long. If maybe it should be 4 months. And
Well, most
so
people
I
are
wanna
taking
weigh everything. I mean, I really want to look at this and have these hard conversations. And at the end of the day, if we're going to try it, we have to go into it realizing that not everybody has to choose to do it. And if for those folks who do choose to do it, if we hear that it's not working, we can rescind it. Or do we, and I'm not coming up with this. I have really smart people emailing me on both sides of it. going, let's focus on the bigger picture. You know, we need daycare. What do we do as a county to help these employees so they don't have to bring their babies to work? I don't think anybody really wants to go try and be a really good mom and a really good employee and a really good coworker all at once. I mean, nobody wants to be in that position. That's a lot of pressure, you know, but it's like a relief valve. Something's got to give. I get that. So I don't know. I mean, I appreciate this conversation. I want to have this well thought out, and I want to be really respectful of everybody's input. And not everybody's going to be happy with the outcome at the end of the day. And I don't know what the outcome's going to be.
Yeah.
But there are going to be people who are happy and people who aren't.
Right. So, and the other thing to keep in mind is we're proposing it as a pilot.
Yeah.
So part of the action of the board, if it is taken, is to implement it for 6 months or to 12 months or what have you. It's meant to be a pilot program to see if it even works, because it may go down in flames. We don't know. But it may not. And so that's the other thing to keep in mind is it's not meant to be a permanent policy. It's presented as a pilot program to try it out to see if it works. And lowering the timeline to 4 months. I mean, majority of people are taking at least 3 months off because FMLA allows for that. So, you know, most people are not going to come back at 6 weeks. They may come back at 8, but most are not coming back until 12 weeks. And so then you're only looking at a maximum of 3 months. Yeah.
Oh, if you're talking a pilot program, and I'm not sure how to do this.
Not airplanes.
How do you measure if it's successful or not?
We could do an employee survey again.
I would forget the survey.
Okay.
You're gonna measure this by the bosses
Mhm.
and those folks.
Mhm.
And actually, I'm almost convinced we don't need a policy. Because that, to me, opens up more problems. It's an individual assessment by the bosses, is the way I'm looking at this. I mean, you're never gonna see them riding around in the cop cars, but maybe.
They do in some
Oh,
counties.
it's on the EMS.
EMS too.
They might.
But there's a lot of times EMS could probably babysit pretty good.
Actually, they used to take their dogs to the EMS stations, by the way.
They do.
They used to. They don't even.
Used to.
But the only concern with that is the multiple departments that are reporting directly to me. I need to hear from you that I'm not going to get in trouble for allowing that to happen.
Right.
Well,
You know what I
they're
mean?
Responsible for their own group. So
No, they
Sure,
report to
Brad.
me and I'm responsible
Well,
for them.
you
It's
just-
only elected officials who are responsible for their departments
Well,
without
it-
me.
I think it's helpful to have a policy just to set expectations. So I think it's important just to have the policy for expectations of this was the plan originally, this is what's going to happen. If my child's crying for this person at a certain time, this is what I have to do. If there's going to be a reevaluation, if there's going to be a termination, it's all laid out there. So there's no surprises. And I think that's why policies of this nature are so important, just so you already have a template of if this happens, this is how I react. And so I would advise against not having a policy or against not doing it. But
Jackie, what percentage of the employees would be direct reports to an elected official versus admin?
I feel like I should know that offhand, but
You have a sense, Katie?
Less than half.
less than, yeah.
Less than half
Mhm.
report to an elected official. I'd say
Oh.
probably for sure less than half.
Yeah, because the EMS is pretty large.
Yeah.
But the sheriff's office
Yeah.
is also a very large department.
So I could,
Probably around like, I would say 35-40% report to an elected official.
and I could debate this subject on both sides. Karen said something that I think merits part of being in the conversation. I use a different word than you did, but it's modernizing your practices. The way we employ people are so much different today than it was 30 years ago. The needs have changed. The cost of childcare has changed. I wouldn't have any problem if it was a pilot program, but that pilot program is going to be for a year. It's not like we're going to have an abundance of people in the next 6 months that are qualifying under this. And I'm with Gary. I'd be more interested in saying, okay, what are the bosses saying?
Mhm.
If you surveyed the employees after a year, you might get a bigger number of responses, by the way. But
Right.
yeah, but it's knowing that that may not happen. Now that I realize the sampling size,
Mhm.
yeah, I'd be using the bosses, but
I also think that, I'm sorry.
no, I just want to, the final note I want to make is repeating myself. There are a lot of things that don't feel right because they're different,
Mhm.
but that's all about change. That's all about modernizing how we do things. And I hate to say this, but sometimes the people that are in the minority have the bigger vision. In fact, history shows you that generally that's the case.
Well, and I just want to know, this policy is still fluid. So if there's something you see in here you might not agree with, if you want to change anything, I would be more than happy to talk with anyone, employees, any of you. And I would be so happy to just talk about what could change, what could make it better. So I just want to make that very clear as well. I'm really open to the dialogue about it because I want this to be something that fits Benzie County.
You know, I'm a big believer in it takes a village kind of thing. And I have played a role in a young person's life where I was the Tuesday mom and I took the baby on Tuesdays and for 2 months, just so she could get through. And so for me, if this wasn't, I guess in my mind, what I pictured when you said it was mom getting ready for work, loading up the baby in the car seat, and 5 days a week, 8 hours a day, she's bringing in the baby to work.
Mhm.
And I think when I started having more conversation, what it sounded more like it was going to be was this mom was going to try and utilize her village to the
Yes.
best of her ability when she could find help, or grandma or somebody could, and maybe on Thursday the baby needed to come to work with her. You know,
Mhm.
that to me was more palatable and more of a stopgap measure and something that people would be more open to. Because I see you're trying to do, you know, again, I just,
Yeah, that's good.
I think that scenario is
point.
probably closer to reality.
Yeah.
that's what I
Yes.
would,
I
you know,
hope-
I would like to see as a workplace that, again, it's not what you pay people to come to do work to do, take care of their children and work. You just don't.
Or have your coworkers take care of your child for you.
Or have your coworkers take care of your child for you. But to Art's point, you know, this is a new model that's uncomfortable. I can argue both sides of it
Mhm.
really well if I had to. So I just, I don't know what's gonna make it a tipping point for me. I get it. I get both sides.
Yeah.
And I don't know where we want to fall on this.
But
Most individuals that are interested in this, we're gonna use it as more of a, you know,
A village.
a village approach, not
Village.
all the time.
Please don't use that.
You don't want to be
County
part
out
of the
there.
village people,
No, people.
but both
People help each
individuals who
other.
are interested in this program, it wasn't a full-time,
Sure.
I don't
like
get
that
any
approach.
it wasn't a full-time only option program is the way those two individuals were viewing it. It was a when needed or 1 day a week, 2 days a week, because, you know, they don't have childcare those days, but they will in 3 months or what have you, because, you know, 12 to 18 months is not unrealistic for a daycare waiting list. And
Mhm.
so it's just bridging that gap in a lot of ways.
you know, it's really pushed this button is COVID.
Yeah.
Yeah.
And the number of people that did not return to work.
Yep.
And it's a greater number of women than it is men that didn't return to work. And so this is what forces us to look at other options. I think the bigger solution is about childcare.
It is.
About the legislation of childcare, about the cost of childcare. But that's that's taking a big bite of that elephant. You know, so you're looking for something on an interim basis. And I'm not prepared to make a decision either. I want to make some calls also like you did, so
Yeah.
some bigger employers, because I'm curious to see where is the world headed?
Mhm.
Definitely.
And probably
And
in
could-
public comment, we're going to hear something
know.
on this too.
I think
So,
that-
Yeah, and could you reach back out to the person who submitted that letter if they were open about talking about that?
oh,
I'd like to hear the downside. I mean, what were
Sure.
I don't want to hear just how it was rosy and it was great and it helped out. What did you struggle with? Where did you feel pushback from
Can I tell you?
coworkers?
Because
Absolutely.
My child
Yeah,
was
in
the
there.
first child
Yeah,
to do
please.
the program.
Okay.
And the biggest struggle I had was the naysayers who gave me the cold shoulder because my child was around. That was the biggest struggle I had. Overall, it was a positive experience, but I had a quiet baby. Mine didn't cry all the time. He slept all the time. And so it wasn't horrible. As he got closer to that 6 months, yeah, your productivity definitely does decrease. But the biggest part of it that was uncomfortable was the naysaying employees because they were not gentle about it. Mhm.
Another aspect, where does the child sit and live with the caregiver?
What do you mean? Like
You might
somebody
have
else?
limited space at your desk.
Oh, I wore the baby.
Oh, okay.
Yeah.
So we're gonna run a lottery. All the commissioners are gonna take one home periodically.
Oh my gosh, will you do
the
that?
two
Mine are a little
sit down.
older, but
No, I enjoy doing that.
Well,
I'm worthless for anything else.
why didn't you tell me before I committed to summer camp? Jeez.
so moving forward, would you like me to bring this back to the committee a whole next month? Like what would you like to see the next steps be for this? Because I know you're not ready to make a decision now.
I think talking to her, like Rhonda suggested, and getting that whole, that would be very helpful. That's a great idea.
Well, if she's willing, I mean,
Yeah.
Katie basically shared, and I
Yeah.
think it's gonna be dissimilar.
Yeah.
The closer to the 6 months, it's harder because
Okay.
they want the more interaction. That's for sure.
Well,
At first, it's not.
And the people that I talked to, the entities that I talked to were the moms knew when it needed to end.
Correct. And you do. You do.
And, because they needed to get their work done. So, but by the same token, if you don't have the policy, the work's not getting done. So you're going to work, you're doing your job. That's what the taxpayers expect. And so there's a hard line on this. And there's a flexibility, a pilot, this is a snapshot in time. And we'll go back to normal. But that's, it's kind of what we're doing with Charity being back in Rose's place now. I mean,
We're struggling right now, but we're getting through.
Yeah.
And the other thing too, shoot, I just lost my train of thought.
It'll get worse.
Sherry.
Not about Sherry.
Happens to me all the time.
I know. Oh my God. It had something to do with knowing the time to send them away.
Oh, sure.
Yeah, I mean.
I would like to see a new survey of just the bosses.
Oh, the bosses. Now you triggered my memory. So a lot of this too has to do with the bosses because, the lower productivity, it's up to that supervisor to identify the work that's being missed. And if that's identified, then the program ceases for that person, and this policy is very strict in the sense of if work is not getting done and, if that falls under disciplinary action, those who are being disciplined in any way aren't even eligible for the policy. Probationary employees, I don't think we're eligible. Or do we?
Well, we changed that because some employees are on probation for a year. So I didn't really want that to be a deterrent, but
Yeah.
so we're stressing more of the disciplinary, being in good standing and
Yeah.
working out the exact definition of what that looks like and what that means. That's one of the things we're still working with the attorney on, but
Yeah, so it falls a lot onto the supervisor to take on that task of assuring that their staff person is doing what needs to be done to work effectively. So, if that person identifies things are getting missed because one day a week they're essentially not working, then I guess their baby doesn't come to school anymore or doesn't work anymore, and they have to find alternative care. So it's not meant to just bring your baby to work and have fun all day. There's still a job to be done.
so at the end of the day, I mean, we know that childcare was one of the big three identified in the community as a problem to address. Have we taken the view as a board as we're still waiting for people to come forward with viable projects? Or are we taking the position that we should be more proactive in looking into solutions from a county perspective? I mean, one idea that occurs to me is, Grow Benzie has space. Both of the schools have childcare programs where they're trying to teach students how to get into the childcare. I mean, is there an opportunity here to create something that the county and the schools could use for childcare? I don't know. I don't know what the answer is. I just, we can't stop looking for the solution.
No.
The thing we need to be guarded against is continuing to look for new information to delay a decision. I've seen that happen way too many
Sure.
times in groups. You asked, what is the next step for you? Gary probably made a pretty logical request. Let's just look at the department heads and see how they feel about it.
Okay.
But at some point in time, it's a roll of the dice. And it's let's say we decide to move forward with it. For those naysayers, we're going to have to talk with them, get them to be open-minded about, we're going to experiment with it for a year and just don't walk into this negatively, but give us true feedback from what you're seeing. Because I've had, I have made decisions that I was glad that didn't come through because I was making the wrong decision.
Yeah.
If you know what I'm saying.
And I don't even know I think your point is good, Gary, to know, but I think we already know. I feel like I already know what elected officials would allow it and what officers wouldn't. Because it can't happen up the hill.
Well, it could.
It could.
Susie, Linda, and Lisa's positions are all administrative positions, potentially. I don't know why it couldn't.
Okay.
Mhm.
I mean, at the end of the day, the department had the elected officials who are gonna allow it will, and the ones who won't. And I mean, I don't know why knowing that on the front end changes any decision whether to allow it for the ones who will.
That's a good point.
I think it gives us a stronger idea for the entire management of this organization, where they stand. A lot of times these surveys only result in people that are totally against it or totally in favor of it.
Mhm.
And
I thought we'd see a lot more no's, honestly. Because usually those are the folks who respond first.
Jackie, do we
Well-
know if any of the respondents were department heads?
There could be, it's an anonymous survey, so I'm not, I don't know specifics.
I would propose getting the information that Gary requested
Sure.
and having it for the actual board meeting in 2 weeks. I mean, at some point, we're gonna have to take a vote.
Okay.
See where we stand. on
Okay.
this.
We'll put it on for June 27th.
All right,
We'll get that data.
great. Thanks so
Thank
much. If
you.
you think of any questions in the meantime, feel free to call or email me.
Sounds good.
Thanks so much.
Thank you. Anybody have anything else to add to that conversation? Okay, we will move on to our final public comment.
So I'm Karen Fallon, and I just want to make sure you guys don't underestimate your employees here. They are good people. I felt like I heard a lot that there's expectations that there are a lot of naysayers. A lot of people came to me and gave me some really good information, and I think it's really valuable. But I think what wasn't fair, what people had a complaint about was the survey, where they felt like it was, you were forced into a situation. So if there is communication with employees, which it doesn't sound like that's what you're interested in, you're more department heads, but just don't underestimate the people that work here. There are really good people that work here. And I think the biggest concern is that it is a place to come to work. And it's not so much that I can't do it, so she couldn't, that she shouldn't. It's the benefit just doesn't seem to be equal. And the other thing that I wanted to say was, like, it concerned me to hear that the employee who gets the opportunity to bring the child to work, this policy potentially could penalize them for something. And I don't know if I misunderstood how I heard that, but I feel like what I heard was, if your work isn't getting done because you're bringing your child to work, which we implemented a policy, now you're gonna, possibly stand for, some type of repercussion, disciplinary action. And I think that's wrong. I don't think, if you're gonna allow somebody to bring a child to work, then you're gonna have to expect all these kind of things to happen. So I would hate to see somebody get reprimanded for bringing their child to work because they can't get their child quieted or something. They got to take them home, and now they're going to get in trouble for it. That just seems contrary to a policy that someone says is modern and moving forward. So I hope that that's something that you eliminate from that. I don't think somebody should if it's approved, don't reprimand somebody for being able to take advantage of it. All right, that's it. Thanks.
I'm trying to remember how I answered it, but I thought about both positions. I have no employees now, but I did have employees. Whether my employees would have fallen in it or not wouldn't matter, but I guess on the productivity level, when I was thinking about a supervisor's position, if someone could come in and I know that their productivity is going to be diminished because there's a distraction. But if I, based on the fact that we don't have excess employees and the work has to get done even for the taxpayer or whatever, that even if I got 60% out of somebody for the day, it's better than them going, I don't have daycare, I'm calling in sick and I get 0%. So I guess that was my thought process on the boss process and the productivity level. It's going to be diminished. It's guaranteed it's going to be diminished, but is that okay as long as the phone got answered when it was supposed to and that type of thing, as opposed to it not getting answered? So that's my boss perspective.
Thanks, Beck.
Anybody else? Yeah, I'm gonna close public comment.
Motion to adjourn.
Dang, that was quick.
Well, we can all wait a little while.
What else should I talk about? What's next on the agenda?
Well, I'll second that for
All
discussion.
right, all in favor, say aye.
Aye.
Thank you, everyone.